Okay, this is part 2 of the most memorable lines in nutrition and health. We're doing this in June 2025. So Caldwell Esselstyn says, no oil, not one drop. He repeats himself, no oil. Moderation kills. Those patients don't get better. You only see heart disease in the countries that eat a lot of meat and oils. Coronary artery disease is a food-borne illness. Coronary artery disease is a toothless paper tiger that need never exist. You can take control of your health with a low-fat vegan diet with no oil. You can make yourself heart attack proof. You no longer need to have the sword of Damocles hanging over your head. Low-fat vegan diet has 0% morbidity and 0% mortality. Doesn't get any better than that. Okay, the next is Gerald Curatola. He's a dentist, and he wrote a book. He's got a lot of YouTube videos. He knows a lot about the teeth. He doesn't know actually that much about nutrition, but here's some of his quotes. Olive oil is liquid gold for corporations. It is the core of the Mediterranean diet. Dr. Neil Bernard, olive oil and other vegetable oils are better for your heart than chicken fat, but they're just as fattening as animal fats. As it turns out, though, if you look at the long-term effects, like from the David Blankenthorne papers, the more fat you eat of any type, they're all similar in amount atherogenic. And, the fatter you get, the more fat you have being released in your blood, the so-called spillover effect, etc., the inflammation. Okay, Nathan Pritikin, fat is bad. There is no such thing as a normal occurring diet that's deficient in fat or protein. We really only need minimal amounts of fat. He showed studies where patients were eating less than 1% of calories from fat and doing quite well. Studies with controlled diets where people ate 0.75%, less than 1% of fat, did very well. Okay, Michael Klaper, Dr. Klaper. Paleo-keto diet is self-inflicted eugenics. You can't do just one thing in a bodily system. When you change one thing, you're going to change other things. Olive oil is not good for you. There is really no such thing as lean meat. Okay, that's Dr. Klaper. Okay, here's Dr. Ornish. It is better to make big changes than small changes because big changes generate big results, and that increases motivation. Okay, Rice Swank, MD, PhD, the guy who figured out multiple sclerosis. Central Norway eats a lot of saturated fat, and they have a lot of MS. Coastal Norway eats much less saturated fat, and they have much less MS, which indicates it's not likely just the sunshine and the vitamin D, it's the diet. Swank continues, the Chinese diet is mostly right. It's very low in fat. I don't think there were any MS patients in China, so a big country, they couldn't find an MS patient. Dr. McDougall, the fat you eat is the fat you wear. You can do a biopsy of people's fat tissue, and it'll be the same as what they eat percentage-wise in their diet. Fat paralyzes the insulin receptor. Diabetic patients, instead of carb counting, they should be fat counting. Jeff Nelson from VegSource. The fat in nuts is also bad for blood flow. I did a whole video on that. The benefits of omega-3 fats for the brain are highly exaggerated. He did a whole video on that. They're both very good videos. He's got the best videos of any YouTube channel about dietary fats. Michael Brownlee. Excessive dietary fat causes reversal of electron transport in mitochondria. This causes insulin resistance. Okay, he was a Brownlee diabetes winner in 2004 for research. Gerald Shulman won that award in 2018. He says, with nuclear magnetic resonance spectroscopy, we have confirmed that excess fat in skeletal muscle is the main cause of insulin resistance. We call this the ectopic fat theory of diabetes. Okay. Well, yeah, and that sounds a lot like Roy Taylor. I forgot to put his quote in here, but Roy Taylor is the other Banting Award winner. He won it in 2012, and he said diabetes is simply a disease of excess fat and fat in the wrong places. Okay, if you can cure the patient's fatty liver, you can usually cure their diabetes if you catch them before, definitely before 4 years, but probably usually before 8 to 10 years. And he had a whole bunch of patients, Roy Taylor, who he got them to lose 30 pounds or more of body weight, and they were cured of their type 2 diabetes. Okay, Kim Williams, MD, the cardiologist, he said there are two types of doctors, vegans and those who have not yet read the literature. William Roberts, the pathologist expert on coronary artery disease, he said when you feed a high-fat diet to herbivores, they all get atherosclerosis, and humans are herbivores. Eggs are what you feed to an animal to cause atherosclerosis. He also wrote a fantastic paper about over 2,000 autopsies on patients who died of myocardial infarction, and he said, Coronary artery disease, atherosclerosis, is always diffuse. Single vessel disease, that idea is a myth. Okay. And he was a big believer that by far the number one risk factor for atherosclerosis was elevated blood cholesterol. And I should have actually put Dr. Gregory Sloop in here. Dr. Gregory Sloop is the guy who did a lot of work to figure out atherosclerosis, the pioneer of the atherothrombosis theory. And Dr. Sloop said, basically elevated LDL cholesterol, it overcomes the negative charge on red blood cells, the zeta potential, because the LDL is a big enough size and it's positively charged, so it sticks the red blood cells together. And that causes rouleau formation, or blood sludge, you could call it. It also turns out triglycerides do that, chylomicrons do that, uric acid does that, fibrinogen does that. Okay, a quote by me, Peter Rogers, there's no such thing as good fats except secret fat. Fiber is the secret fat or good fat, and it's the safe fat because it travels through your gut without doing anything to increase your risk of leaky gut. And then the good bacteria are converted into short-chain fatty acids. Most importantly, the butyrate, which is used to prevent leaky gut. And the other two short-chain fatty acids, the acetate and the propionate, go to the liver and they can be made into other types of fat. Olive oil is for chumps. There are no faucets on olive oil trees. Olive oil is a highly processed liquid fat. With a name like extra virgin olive oil, they take advantage of man's protective nature towards women to make it sound like his new bride, something in the bedroom. Okay, soy and flax are Tweedledee and Tweedledum. They're both high fat and highly estrogenic.